using handhelds for success. Next slide, Tim. Digital content is everywhere. 69% of students and 73% of students have used digital content in the classroom. We all know tablets are convenient. 26% of students and 34% of faculty have used a tablet in the classroom, and 47% of students want faculty to incorporate tablets as a learning tool in class. Additionally, 33% of students and 31% of faculty have used telepresence in their classroom. Springer Publishing surveyed hospitals and found that 2/3 of their nursing staff use smartphones for clinical reference because they're portable and easily available at the point of care. They have the latest information at their fingertips. They provide support for clinical decision-making. They build student confidence and competency, and they increase patient safety and quality of care. For those who are not familiar, Skyscape is the worldwide leading service for trusted medical information by specialty for mobile devices. We've been developing apps for the healthcare provider for 20 years. We are launching a new app, a new generation of the Skyscape app, the Skyscape Medical Library. Find it today in the Apple App Store and in the Google Play Store in the coming weeks. Our speaker today, Dr. Tim Bristol, will discuss and share his thoughts and experiences on flipping the classroom, handhelds for success. Please welcome Dr. Bristol, owner of NurseTim.com, faculty at Walden University, as well as esteemed member of the Board of Directors for Healthy Villages. I will now hand the floor over to Tim.
Thank you, Kristen. I appreciate this opportunity, as always, to help faculty, help nurses, help students look at the education process a little bit differently. What we hope to do over the next hour is to give you a little bit of background on flipping the classroom, why we're headed this direction, and give you some very manageable tools when it comes to flipping the classroom. And Skyscape just does a wonderful job with this. Just this past Friday, I was with 150 educators, and we were able to look at Skyscape as a way of turning the classroom into clinical. And so I hope to give you a little bit of that. We're limited to an hour right now, but I do want to know a little bit about you. So I'm going to take a time for a few voting polls. So I believe Kristen's going to put this poll up for us. And I'd just like to hear from you. Do you currently flip the classroom? And we do have a chat box open, and you're more than welcome to go into that chat, leave a bit of feedback there for us as well. But I would like to hear from you. You know, if you are flipping the classroom, what brings you here today? I'd like to hear that from you as well. So please use that chat window whenever possible there and type that in. So thank you for the poll. And I think we got our results coming through here in just a moment.
Yeah, I'm going to close the poll. One more second.
Okay.
We have about 80% who voted. Any last votes? We're going to close it now. Uh-oh,
Okay.
What happened? Do you see it?
I see my slide.
Here we go. So we have 42% who said yes and 60% who said no. So hopefully we get some good learning out of this today, Tim.
Okay. Well, I appreciate that. You know, and when it comes to flipping the classroom and the true definition of flipping the classroom, I don't think my slides are back up. Oh, there they go. Okay. What's happening with, okay, so in the purest sense of flipping the classroom, we're taking lecture time and we're trying to use that broadcast lecture, if you will, we're trying to move that out of class for the purpose of, not to get rid of it, because I still believe that our students need those explanations, need those verbal explanations, those visual explanations. They need that guide on the side, if you will, to help them work through the material. But at the same time, what I want to happen during class is practice applying the concepts. okay? And from a healthcare professional's perspective, especially from a nursing perspective, we call this clinical. We call this clinical. So my goal is that class time becomes clinical time, and that we find ways of our resources helping students outside of class get ready for that clinical time. Now, the other thing that I want to point out with my take on flipping the classroom, if you will, an important instructional design issue is going to be, how do we get the students to connect what's happening in class with clinical? And one of the best ways to do that is by using clinical tools during class. Okay, so this is where Skyscape is going to come into play. We're using Skyscape in our clinicals. We're using Skyscape in our simulations. We're using Skyscape in lab. Let's use Skyscape during lecture, during that classroom time, okay? And the reason we're wanting to do this is we want to have students more in that apply, analyze area, and hopefully even moving into evaluating and creating. So we want them in the upper parts here of the of Bloom's taxonomy, if you will. Now, the evidence base for flipping, the evidence base revolves a lot around there, and there is research coming out directly on flipping the classroom. So, for instance, just recently in the Journal of Nursing Education, a group of researchers discovered that it's very similar to active learning when it comes to improving outcomes, but initially having less student satisfaction. And I found that very interesting because that showed up in the literature back in the 90s. That showed up in the literature in the early 2000s. So even though the students are getting better grades with flipping the classroom, some of them are going to say, hey, I'm having to teach myself. Now, we tend to call this lifelong learning. But when you're a student, you want to know what exactly is on the exam next week. So all that to say, when you're flipping the classroom, what happens during class time has to be on the exam next week. It's essential. Don't spend an hour and a half walking me through a clinical experience that doesn't show up anywhere on the exam. That's not fair to your students. And class time is so limited that if it's important enough to be on the exam, it needs to be in class. It needs to be in class. So, so they need to have that as part of their experience. Now, when it comes to flipping the classroom, the prep is the priority. And we want the students, again, seeing the connection between prep and class time. That's why we're going to guide their prep. And students are always asking for a study guide. I'm like, nope, I'm not going to give you a study guide. What I'm going to do is give you guided study. Guided study. Please write that down somewhere. Guided study. The idea being that you're going to use tools during your study time that are going to show up during class time. You're going to see how important that prep is. And so we're going to guide their study by guiding them through Skyscape while they're studying, getting ready for class. Then they're going to have to pull Skyscape out during class, during clinical, and take care of a patient. And so this guided study allows them to see that consistent going back to these tools. Now, I prefer to look at flipping the classroom, looking at the Skyscape platform as a clinical decision support tool. Okay? When I say clinical decision support tool, what I'm referring to is a tool that's clinically designed, if you will, with clinical in mind. Now, why is this important in school? This is important in school because students are always hearing from us, go to the evidence base, go to the evidence base, go to the evidence base. Unfortunately, many times what happens is they go into clinical and they don't see anything that looks like the evidence base we kept pointing them towards in class. Okay? Now, I get it. We need CINAHL. We need ProQuest. We need those databases. Yes, I get it. We need the research that backs it up. But in reality, what we need is the evidence-based practice on the fly. We need to be able to access that quickly. Okay, so students need practice with this, and they need to see these clinical decision support tools being used as the evidence base. So all that to say, Skyscape's going to give us that consistency. It's going to be that tool that's going to give context, if you will. So I'm gonna switch over here to my Skyscape platform and just give you a little look at what I'm referring to here. Now, one important thing to keep in mind when we're talking about this platform, you need to make sure and educate your students on the understanding that sometimes Wi-Fi is not available. And so, for instance, if I'm using my Skyscape to study for class tomorrow, if I'm using my Skyscape in clinical, they're going to be able to turn off that Wi-Fi and still get access to their tools, making sure that they understand they don't have to be connected to have these tools. And that's important to me, because I believe the students need to be able to do that. Now, they do need to connect at times to make sure that they have up-to-date resources. But this just gives you a little bit of a picture of that consistency. The other thing that I want to point out that's important to me is being able to pick and choose the evidence base that I want my students going to. So, for instance, you'll right here in the middle, there's my clinical companion for my med-surg text. Okay, we use this med-surg book across the curriculum. We use this clinical companion across the curriculum, so I want to be able to pick that, and that comes from one publisher. And then there's my med dictionary. That comes from another publisher. And then there's my drug guide, my Mosby's drug guide. Again, I want to be able to put together the evidence base that my students are going to continuously see across the curriculum. And that's where the Skyscape platform comes into play. So in the Smart Search here, up here at the top, no matter what resources I have loaded, I can look up, let me see if I can spell emphysema here without messing that up. I can look it up. It's going to look at all of my tools. I have one consistent resource to go to. My students aren't having to go in and out of multiple resources. So I can go right into my clinical companion, and it takes me right to that particular monograph, if you will. Consistent tools are important, okay? And when we're flipping the classroom, we hear it all the time, don't we? What happened in class doesn't look anything like clinical. Well, now it's going to, because Skyscape's showing up in class, Skyscape's showing up in clinical. So that consistency is important for that reason, and that's a pretty important instructional design principle. In order for me to transfer what I'm learning, it really helps if I see something familiar. If I see something familiar. So if this tool is showing up during my study time, during my class time, now shows up in clinical time, the students are going to have a much easier time at accessing and that information that they're used to seeing. They're going to have a much easier time seeing the connections between these different environments. Now, the other parts that I want to point out here, flipping the classroom is a very student-centered approach to learning. Very student-centered. The student's busy the whole time during class. So, for instance, I'll hear this often. Yes, I had my students using the resources at home and picking a top 3. Now, there's 90 students in my class. So they went into, let's say, for instance, the Skyscape monograph. They picked the top 3 most important concepts in that monograph. Let's say they were looking at the emphysema monograph. They picked the top 3 most important concepts out of that. And then when they come to class, I randomly pick a student to present to the entire class. Don't do that. Put the students in groups of 2, 3, 4, and 5 and make everybody present. Yes, even simultaneously. As in, everybody has to present in their own little group of 2, 3, 4, and 5. It's not one student presenting to the whole classroom. And then what does the instructor do? The instructor works the room. So the students all have their Skyscape open. They're opening up their med-surg, their clinical companion, and they're saying, okay, here's the emphysema protocol, the emphysema monograph, and here's the top 3 concepts that I picked out of that. And they're talking about it in their groups of 2 and 3, and every person has to present. If you have a classroom full of 90 students, and you're only asking one student at a time to present, you know that you're only going to get 2 or 3 students done. No, every student needs to present. That's student-centered. The other part of this concept, and flipping the classroom especially, is it gives the learner autonomy. it gives the learner autonomy. And it gives the learner autonomy for a couple of different reasons. First of all, because you recorded your lecture happening outside of class, that student is fully in control of the lecture. That student can rewind it as much as he or she likes. That student can stop it, pause it, delete it, not listen to it if he or she likes. That student is fully in control, and that's really important. We know that if we can put the pause button in that student's in that student's control, under their control, they're going to be able to customize excuse me, that resource to meet their needs. Whereas when a group of 90 students shows up in my lecture hall and I give a broadcast lecture for 50 minutes, 120 minutes, 300 minutes, whatever your day might look like, I'm in control. I have control of the pause button. There's no learning theory to support that. You do a good job of explaining, let's say, the concept of acid-base. You do such a good job of that, of explaining acid-base. Put it in a recording and hand it to your students. Let them have access to you 24/7 via that recording, whether it's audio or video, doesn't matter. And so this autonomy means that the learner gets to pick and choose. You're one of the resources the learner's using. And then this idea of constructivism, building on what they already know, building on what they've already experienced. Students, you came to class today with the 3 most important concepts picked out from this monograph. Now what you're going to do with those 3 most important concepts picked out from this monograph is complete a case study as a group. So you're building on, you asked them, part of their assignment was to go home, look at the emphysema monograph from their clinical companion, pick out the 3 most important concepts. Now they come to class, and they have to provide care for a patient. We call it a case study. We call it a paper-based simulation. We call it a, you fill in the blank. But they do something with it in class. That's constructivism. And that's how we're helping the students get prepared. So do you feel like, do your students feel like they need to come to class prepared? What do you think? I'd like to see your voting on this, because this is an important piece. This is an important piece. And when you talk to students, it's a very mixed bag. Every student wants in their heart to come to class prepared. They want in their heart to come to class prepared. Otherwise, they wouldn't be in college. Okay? And I know some of you are just going to disagree with me, and that's okay. It's good to disagree. That's what built our country. But when it comes to, do you need to prepare, they're going, okay, I've got 3 kids at home, 2 are in soccer right now, my husband drives truck, he's out on the road right now, I've got a quiz in another class tomorrow. Do I need to come to class prepared today? Probably not. Because there's no good reason to, because I'm going to come to class and Tim is going to give me everything I need to know for next week's exam. Why would I spend all this time studying? I might waste time studying because I might study something that's not important. Your students have to prioritize. They're crazy busy. These are crazy times. And so we have to give them motivation. We have to give them a reason to be prepared. All right, how's our results looking here? Kristen, do you have some results for us?
We have about 75% who voted. We'll give 5 seconds more. Anyone who wants to vote, go ahead and vote, please.
Going once, going twice.
2 seconds, 1 second.
If you vote, something really good's going to happen to you in the next 5 minutes. I just know it.
All right, we're going to close the poll with 80
networking
voted. And here are the results. So we got 40% who said yes and 54% who said no.
Yeah. So here's the crux of the matter. Let's take a look at this next slide here. When it comes to preparation for class, we've got to give them a reason to do so. We've got to get them thinking about this. So, for instance, one of my strategies is a quiz that requires use of these tools, use of these resources. Okay, so we can, and be sure, I use the word quiz flippantly. I know some of you have policies in your syllabi that say all quizzes must be completed at this level of proficiency, and if you fail so many quizzes, you have to retake the class. I'm looking for an activity that, yes, has a little bit of grade attached to it, a little bit of teeth attached to it, but a lot of hope attached to it, okay? And here's where a quiz might be, okay, this is an open book quiz. You're going to have 10 minutes, 10 questions. Open up your drug guide. Open up your Mosby drug guide on Skyscape and take this quiz, okay? And we might do the same thing with a case study. At the end of Chapter 38, you're going to find a case study. And this case study is showing you X, Y, and Z. I want you to open up your Skyscape resources, and your prep for class is completing this case study using your Skyscape resources. Now notice, this sounds a little bit different than go home and read chapters 30 to 38, doesn't it? This actually sounds like you're taking care of a patient. What are our students in class for? What are they in school for? They're in school to learn how to take care of patients, to learn how to provide high-quality care. What are the top 3 monographs? This is your ticket to class, and I want to show you what this looks like. I'm going to see if I can get back to my Skyscape here. There we go. What are your top 3 monographs when providing care for a patient of this nature? And don't clear out your history or bookmarks, and I'm just going to show you exactly what I'm talking about here. I go into my history. Can you see that okay? Is that coming through? There we go. A little bit of rezzing. The student, as their ticket to class, can walk in with their phone, their iPad, whatever they use Skyscape on, and they can just have their history open because their ticket to class is showing you what 3 monographs you used, what 3 parts of Skyscape did you use in order to take care of this patient. That's your ticket to class. And so they can walk through the door with their history open. They can walk through the door with their bookmarks open and just show you, here they are. Now, students, before you even sit down, find someone in the class you have not yet talked to today, and you two compare bookmarks. You two compare your history. Why? Because I want them to defend their 3 choices. This is called reflection on learning. Reflection on learning. Now let me give you a little background on reflection on learning because this is really powerful stuff. When you have to defend why you chose what you chose, that makes you learn even better. Even if you were wrong, even if you made the wrong choice, but if you and your buddy are standing there going, wow, you picked these 3 monographs, I picked 3 totally different ones, and here's why. You're reflecting on learning. And not only are you reflecting on learning, but you're reflecting on how you got prepared for class. The other part of this equation is I will try really hard to not let students continuously pair up with the same person. Okay, today you need to find someone in the room that has the same color shoes as you. Today you need to find someone in the room that has the same number of children as you. You need to find someone in the room that you fill in the blank. You haven't talked to yet today. Get with a different person each time because this reflection is going to cause you to learn the material even deeper. Well, no, the patient had this. Well, no, this monograph said that. Well, no, this drug guide said that. Is why I chose the 3 that I did. The other thing that I want to point out here, when it comes to critical thinking and clinical reasoning, when you study those theories related to critical thinking and clinical reasoning, it always happens with someone else. As in, you don't completely become proficient at critical thinking and clinical reasoning by sitting by yourself in a corner with a book. So, here's the story. I was at home doing a case study by myself, and I had to pick the 3 best monographs to help me provide care for this patient. That required critical thinking. Now, I'm going to go talk to my buddy who did the same thing, which required critical thinking. And the 2 of us are going to become even better at critical thinking because we're watching each other develop as critical thinkers. So this critical thinking triangle, if you will, this reflection on learning triangle, if you will, it sounds a lot like what we do after simulation. What do we do after simulation? Debriefing, right? When you look at the literature on simulation, many of the theorists, many of the leaders are saying that most of the learning is going to come in that debriefing period. So I did study at home. That's a pretend simulation, if you will. Now I come to class and I do my debriefing. I reflect on my learning. I defend my priorities. I watch someone else go through the critical thinking process just like I did. So all this to say, this prep for the classroom, if you will, this prep for the classroom is very powerful. And it's way more than just, hey, go home and read 10 chapters. It's, hey, go home and take care of this patient and be prepared to defend your choices when you get to class. That's your ticket to class. All right, we have another voting item here for you. Do your students feel that they are learning what they are learning, feel what they are learning in class is relevant? Do they see relevance? Do they see relevance?
Okay, we're about 70% of the voting, so we'll wait a few more seconds here.
It breaks my heart. It breaks my heart to hear in clinical a professional nurse say, you're never going to need that. It just breaks my heart because one of two things is happening. Either that nurse is completely off her rocker and doesn't use anything related to evidence-based, or it's true. And so what we have to do is make sure that we really are going for relevance, number one. Number two, we have to make sure that the students are taking it to clinical. Because guess what? That nurse that said, hey, what you're learning in class is not relevant, was one of your graduates from your program. And that's kind of sobering. We got to remember, those aren't just some mean nurses out there floating around. They are our graduates.
All right,
that means that we may not have, go right ahead. That means that we may not have done a good enough job of demonstrating to them the relevance of the evidence base. So let's talk about this. Let's talk about this. As we think about classroom is clinical, what you're attempting to do is show them the direct relevance of what they're learning. Okay? So here's where we get them going into the evidence base, them picking out why is this relevant, what is relevant about what we're learning, and having to, again, defend it. Show and tell. Pick those top 3 monographs. Now, you'll notice that I use top 3 a lot. And this is, there's a couple of reasons for this, because I've noticed that when you get into 5 or top 10, students are not going to remember it. But when you get into top 3, what you're saying to the student is go quick, go fast, find those top 3. By the time they found the top 3 and pair up with someone else, they've discovered there's another one in the top 3. Isn't that real-life practice, especially as a nurse? Think about the current evidence base. Think about the current evidence base. If we look at all of the competency sets that drive education, we have the Institute of Medicine core competencies. We have CUSIN. We have the AACN essentials. They all talk about the evidence base for safe, effective care. And I use the word safe first. We value safety. We value safety. The evidence base is part of that. And so I think the evidence base needs to show up in every lecture, especially evidence-based practice on the fly. Evidence-based practice on the fly. And don't allow the students to always sit there and take their time in clinical. But they're going to need practice before they get to clinical. They need to get to that evidence base quickly so that they can do the same thing in clinical. And more importantly, so that they can do the same thing as a professional nurse. let me just show you a little bit about what I'm looking for here. I'm going to go back into my Skyscape app, and there we go. So one of the ways that we show this, that we have students show this, is through what we call smart linking. Okay, so one of my favorite examples, I love teaching fundamentals. But what I want to do in fundamentals is show the students relevance and realism. And many times, as a new educator, I avoided that. I said, you know what? Rheumatoid arthritis is just too complex of a disease for me to bring it up in class. Methotrexate is too complex of a medication for me to bring it up in class. These students have only been in nursing school for 6 weeks. They're only in week 6 of fundamentals. The problem is, we wouldn't do that in clinical, would we? They go to their very first day of clinical, some of them week 7, 8, 9 of that first semester. Are they going to have a patient with rheumatoid arthritis that week? High probability, especially in long-term care. Are they going to have a patient on methotrexate that week? High probability, especially in long-term care. Where do they go for their first clinical? Usually long-term care. And so when I'm teaching, I need to find that realism if at all possible. So we're in week 6 of fundamentals. And I'm teaching them about patients at risk for infection. So students, what I want you to do, go into your clinical companion. Sorry, I got a little bit ahead of myself. There's your clinical companion. Go into your clinical companion. And we're going to look at a disease where these patients tend to be at risk for infection. And that disease, if you go under diseases and disorders, and go under arthritis, rheumatoid. All right, let's go down to the bottom here. You see that? Arthritis, rheumatoid. What I want you students to do, get into your groups of 2 and 3. I want you to look at this monograph. Spend a little time with it, okay? I want you to go through the assessments and interventions. I want you to come up with 3 reasons. Now remember, students, when we choose our top 3, we're not talking about the top 3 paragraphs. I'm talking about the 3 sentences from you. Okay, the top 3 concerns for a nurse related to this patient being at risk for infection. What are the top 3 things a nurse needs to be thinking about with methotrexate? I'm sorry, rheumatoid arthritis. And I'll give them a few minutes. I'll give them 5, 10 minutes. And they're discussing, and they're arguing with each other, and they're going through the monograph, and they're talking to each other. And this is really important time, because according to the Institute of Medicine, if teamwork and collaboration are not a habit for you, you will not be as safe of a practitioner as you should be. So they're discussing. They're going back. And they write down their top 3. And then I'll be like, okay, students, now what we need to do is we need to step into the world of pharmacology. And they're going, oh no, pharmacology? Why? We haven't had pharm yet. Because patients that are at risk for infection are often at risk for infection because of medications we've given them. And again, I'm trying to make class look real. So students, what I want you to do is go into your taskbar, go under Smart Link. You'll see Smart Link here. Now this is a clinical search tool. This is not just a, hey, let's search for a word. This is a clinical search tool. They go into Smart Link. Now what I want you to do, students, you've got in here what's called the Mosby Nursing Drug Guide. And this is going to be the drug guide you're going to use starting next week when you go to clinical. You're going to be looking at this drug guide. So click on the Mosby's Drug Guide. And what the drug guide did is it brought up every medication related to rheumatoid arthritis. And we're going to look at a medication, if you scroll down here towards the bottom, methotrexate. You see that right there in the middle? Click on methotrexate. Now students, I know you haven't had pharm yet, but starting next week, you're going to have patients who are taking medications. So we've got to be thinking about how do these put our patients at risk for infection. So I want you to go through this monograph now. First time we went through rheumatoid arthritis and we said, you know, what are the top 3 concerns for a nurse related to a patient being at risk for infection who has rheumatoid arthritis. Now I'm going to ask you the same question, but this patient's taking what are your top 3 concerns as a nurse when the patient is on this particular medication? So go right ahead, take a look at that. And so I'm walking the students through this process, and they're starting to see the connections. They're starting to see how this all fits together. Many times when we're writing test items, you write a good test item, the student should not be able to go to a book and look on one page in one book to answer that test item. As a matter of fact, if it's truly a critical thinking test item, you need to have to go to multiple pages and multiple books to answer that question. This is doing that exact same mental cognitive exercise, but doing it in class, doing it as a learning activity, showing them how to think, if you will, like a nurse. So keep in mind this evidence-based practice on the fly. How are you going to demonstrate that? And the activities took you through, in my humble opinion, your students need to experience that weekly in your class. Your students need to see that kind of relevance. So even if you're not going to start flipping the classroom tomorrow, it's okay. I get it. It takes a little bit of time. There's some things you got to do to get going here. Go ahead and make sure that the students are experiencing this reality, this realism of evidence-based practice on the fly in class, because they're going to need to take it into clinical. And so there's many other activities that I have listed here, and many of these activities, I just came back from a 10-week trip in Haiti, and we've been able to secure a few devices that have been donated down there, and Skyscape gave us all the software we needed. They even gave us access to some French tools, some French language tools that we put out there. The students are doing the same thing in clinical. They're looking at multiple resources, and then we're showing them how to do that in class so that they're seeing the connection. They're seeing how to quickly access the evidence base. And this is really important in Haiti with our BSN nursing students, because many of them graduate with that generalist RN degree. They go out into a village. They're the only healthcare professional in that village. So they've got 2 choices: provide primary care for that patient in front of them, or tell that patient to walk 5 hours to the nearest doctor. And you know what's going to happen. Many times the patients are going to try other things, other remedies, etc., that aren't the best for them. And so using these evidence-based resources on the fly is absolutely essential. All right, so I want you to think about what's going on in your class next week. I want you to think about how flipping the classroom could start to become a part of your practice as an educator. And many times when we look at flipping the classroom, one of the things that I would suggest to you as a way of beginning is just start helping the students prepare for class better. Prepare for class better. Open up your Skyscape. Open up your tools on your phone there, and pick the top 3 to provide care for the patient in this case study. Now when they come to class, they just share that top 3 with another student. They talk about the case study. They talk about, if you were in clinical, would you have accessed the evidence base effectively to provide care for that patient? I really feel like this is important. I really do. And the Institute of Medicine Initiative, CUSIN Initiative, the AACN, their initiatives, their research, the way that they've implemented this across the educational world, if you will, supports that. Can you do something to help your students prepare for class that looks more like reality, more realistic? How are we doing on the results there, Kristen?
We have about 51% voted, so we'll give it about 5
Okay.
more seconds, and we'll close the poll. So get out there and vote. All right, closing the polls in 5, 4, 3, 2, 1. And I'm sharing the results. Can you see the results, Tim?
I can, and I'm very encouraged by that. For those of you that need coffee, can I recommend Haitian coffee? I had a lot of it over the past 10 weeks, and that was good stuff. I had a cup this morning, as a matter of fact. I'm really glad to see this 77% of you think that there's something that you can do next week. And for those of you that, if you feel like there's something that you just can't get a hold of, feel free to drop me an email. Feel free to drop Kristen an email. She can connect you with me. I'd love to problem solve with you. I'd love to just hear a little bit about what's going on in your world. Is there a way to start this flipping process? And we're going to go to the next slide here. I really believe that the best way for an instructor to start flipping the classroom is to start now. Don't wait for next summer. Don't wait for after the summer is over. Don't wait for preparing your syllabus for next year. I know how that goes. I know how that goes. I've been teaching long enough to know that I am an expert at procrastinating. I'm an expert at reacting to crisis, as in getting ready for a lecture in 2 hours. And so start thinking of something that's just something simple that you can do right now that makes, first of all, that makes prep for class look more real, number one. Number two, that makes your class look more like clinical. And I'm not talking about you have to totally flip your entire class tomorrow. I'm talking about just doing one thing. And a lot of times it's just pulling out that Skyscape, just like they're going to see in clinical. Let them pull it out in class just for 10 minutes and walk them through what would a professional nurse do on the floor. Let them experience what a professional would do. And then is there any way you can get a partner involved? Okay, so Tim's teaching pharmacology, Susan's teaching mental health. What's a strategy that we could both use? And many times it's coming up with those top 3 monographs. Many times it's just getting them into the evidence base. And remember, my goal is evidence base on the fly, because a majority of my students are going to be in environments where if they don't learn how to access the evidence base on the fly, and I like how this guy in the picture is on the fly. I'd love to say that's me, but he's got way too much hair to be me. Anyways, evidence-based practice on the fly is what your students are going to need the most as new professionals. All right, it is time for Q&A, and I think that, let's see here, do we have our Q&As open? Let's see. I'm always trying to make sure I can see the Q&A and see what questions we have coming through here. I might need a little help there, Kristen.
Okay, Tim, well, we have one question here. If I flip a classroom, what do I do with students who don't bring their tablets to class or don't have electronic access or who are not computer savvy?
Mm-hmm. I'm really glad that came up. One issue that we have to remember, first of all, when you look at the IOM core competencies, when you look at the QSIN competencies, when you look at the AACN essentials, being able to manage informatics, being able to access the evidence base, being able to quickly provide safe care is not optional. It's not optional. So here it goes like this, and this has been my experience in multiple environments: inner city, wealthy suburbs, small private, large university, community college, rural, doesn't matter where it is. When you start using these tools, when you start using Skyscape, your students are going to save enough money on buying their clinical resources, their drug guide, their med dictionary, etc. They're going to save enough money on that many times it does help significantly pay for whatever device they choose, number one. Number two, yes, even in the socioeconomically depressed areas, oppressed areas, whether it be rural or inner city, many of your students already have these devices, and in some way, shape, or form. And I'm here to tell you, my son, my 15-year-old, updates me daily on which phones are free at Verizon so he can get a new phone. And I'm like, son, hey, we got too many other things going on to go get another phone. these phones, these plans that these students can activate, they don't have to go out and spend $200. There are Droids out there, there are iPhones out there that are way under $100 that they can get activated that will work these tools. When it comes to having access to the internet, access to Wi-Fi, remember what I told you. Make sure that they understand that they can just simply download their Skyscape once they get it downloaded wherever they have access to the internet and use these tools. All these activities I showed you, no Wi-Fi required. No Wi-Fi required. You can simply get it downloaded and then turn it on into airplane mode. And so that's a really important part. The final comment I'll make there, Kristen, and this is probably the pinnacle of importance, teamwork and collaboration. When the students are doing these activities in class, I want them 2 to 3 people per device. 2 to 3 people per device for a couple of reasons. The most important reason is Institute of Medicine, teamwork and collaboration is not optional. You must learn to work with a bunch of people that you don't like, a bunch of people that are very different from you, number one. Number two, critical thinking does not happen in a bubble. So an important part of making the classroom look like clinical is having students pair up, get into triads, and watch each other develop as critical thinkers. So if Tim's the student that can't afford to buy an iPad, can't afford to buy an iPhone, whatever, shows up to class without one, Tim needs to be in a group where there is one, and Tim needs to be watching these other students learn how to become critical thinkers with these tools. Because when Tim becomes a professional, as we saw in one of the first slides, those tools are going to be there. There's hospitals that are buying iPhones for all the nurses. And that iPhone serves not only as their clinical decision support tool, but as telemetry, the bed exit alarm, texting with the doctor, texting with the pharmacy. It's a one-stop shop. And so, Kristen, my answer to that is there's a lot of different options there for the student that can't afford the technology. And we have to remember that just because the student can't afford the technology doesn't mean that the competencies go away. Those competencies are still a part of safety, not a part of, hey, let's be cool and be part of the 21st century. They're a part of safety. All right, let's see.
Okay, we have another question. Someone had asked, what is your definition of a monograph? And when asking a student to come up with the top 3 monographs, how do you define this?
Yeah, I choose the word monograph because in most of the clinical decision support tools, such as my Mosby Drug Guide, a monograph would be that content about the drug methotrexate. However, in my clinical companion, that monograph might be the information given on rheumatoid arthritis. It's like 2.5 pages. Whereas in my Tabor's Med Dictionary, that monograph might be the definition of the word emphysema. So I use the word monograph myself. I'm sure there's a better word for it, just so it allows my students to know they can pick and choose. The other thing I like to, as I noted before, when I go into my history, I'll show my students, let me get back into my history here, anything that shows up as a tick, if you will, in my bookmarks or my history. And, oh, I apologize. Wake up. Are you there? There we go. Anything that shows up in my history or my bookmarks is going to be that monogram, if you will. So I apologize. I just blew up my reflector. But so that might be a way to do that. Now, if you're teaching in a concept-based curriculum, you're going conceptually, you may want to use different terminology, like concepts and exemplars. You have a different way of describing these. I'm using the word monograph pretty generically. I will encourage you, though, get together with your buddies, because we want to make sure that the students are using these tools every lecture, every class, every day, every semester across the curriculum. Okay, so get together with your other faculty and come up with a good way of describing this top 3. What are you looking for? What would be a good way to describe that top 3? Now, one mistake that I often see, I'll tell the students what will be your top 3, and they'll write down 3 paragraphs for one of my top 3. That does not work. We're really interested in evidence-based practice on the fly. Now, if they're doing their large synthesis care plan, one of the top 3, yes, might be 3 paragraphs. But for the purpose of this, evidence-based practice on the fly and studying effectively and guided study, I want it to be more along the lines of a bullet or a monograph. I hope that helps. I hope I didn't confuse. Any other questions out there?
Hi, Tim. For the ticket to class, how do you address a student that comes unprepared?
Okay. Yeah. There's a couple of things that you can do here. And I think the most important thing is, these are adult learners. Whether they act like adults or not, these are adult learners. And what you have to do is show the importance of these activities, whether it be how you guide their prep for class, whether it be the activities we do in class. And the best way to do that is for them to see it all over the exam. See it all over the exam. As in, when I tell you to show up with your top 3, I'm going to be walking the class and listening to what you're talking about because I'm going to be writing my exam based on the top 3. Or if you're doing another activity with that, the students have got to see it on the exam. They've got to think, and now when we write our test items, we don't do this intentionally, but they've got to think that what they did in class directly affected how you created that exam next week. If they see no connection, if they see no questions related to that, not only is it going to make them very frustrated, but it's just going to show them the class time and your guided prep, using my air quotes here, guided prep, is worthless. The other part of this is you have to remember the student's grade is their paycheck. The student's grade is their paycheck. And I'll ask faculty, I consult with easily 5 schools a month, and I'll ask them, is preparation for class important? And they'll say, you betcha, yeah, it's really important. Then I'll open up their syllabi, and there's no grades associated with it. The grades are associated with 4 unit exams and a final. 4 unit exams, a final, and 1 case study. 4 unit exams, a final, and a concept map. There's nothing in there that says prep for class is important. And I'm here to tell you that's their paycheck. When it comes down to brass tacks, when it comes down to prioritizing my time, I'm going to prioritize to make sure that I get that paycheck taken care of. And so we have to do a little inner reflection ourselves and go, is prep important enough to attach a grade to it? Because in my humble opinion, it is. We wouldn't let a student walk into clinical unprepared. We wouldn't let a student walk into clinical and go, sorry, just didn't have time. No, we would say, go home. You're done with clinical for the day. So if classroom is truly going to be clinical, we need to convey that we value prep for class as much as we value prep for clinical. But that's just Tim's opinion.
More question, Tim, here, and we have time for one more. How can I flip the classroom now with the resources I have until I can get everyone else that I work with on board with the new technology?
Okay. You know, and yes, this is what we call the trailblazer syndrome. But first of all is making sure everybody's in the know. And sometimes it softens the blow if you use words like pilot. And come at them with the evidence base early. I'm going to pilot some active learning strategies that are going to help our students start looking at flipping the classroom a little bit differently. And part of that active learning is going to be using some of these tools. I'm going to try to follow the principle of every 20 minutes doing something different during class. And oh, by the way, I want to use some of the tools that are being used elsewhere. And I know they're using Skyscape in clinical. I see them using Skyscape in all the simulations. I want to bring some of those tools into my class. So I'm going to run a pilot on that. I'm going to try to make my class, so stay in communication with your other colleagues. And then again, going with, like requiring all students to go out and buy iPads just for your class, that might be a tough sell. But if you can just remind them, hey, we've got this tool, Skyscape, that'll work on just about any device under the sun, that's going to go a lot better. And that's going to be a lot easier for them to manage. All right. I think we're about out of time. Sorry about that. I got a little long-winded. I was hoping for more time for Q&A.
What we'll do is we'll collect them all, we'll get them answered, and we'll send out answers to the individuals.
All right.
But hopefully by the end of the week. So I want to thank everyone for your time. We will be posting this webinar, the archive where you can download it, listen to it again, the presentation material by the end of the week. By registering for this webinar, you will get an email notifying you that it's available and where to go and get it. If you have any questions, you can email webinar@skyscape.com, or you can go to skyscape.com/webinars2014. Thank you for your time. I hope you enjoyed this, thought it was informative. Have a wonderful afternoon.
Thank you. Bye-bye.